Just let me know when you go live. Tell me when you go live.
Give it like 20 seconds and then start.
Just hold on. Yeah, let me go back. I think I would first share my screen after I've done the introduction. You're ready, right?
Yeah, go to, yeah, so just mute us. We'll go.
Are we live? Ready to start? I can't hear you guys.
Yes, you can go live.
I can start.
Mm-hmm.
Okay. Hi, everyone. You're welcome to today's webinar organized by the African Women's Cancer Awareness Association. My name is Chris Chukwunyere. I'm a breast cancer advocate and public health practitioner with over 10 years experience. I am into public health program design, development, implementation, and evaluation. And today we're going to be talking about something really very, very interesting, and it's about COVID-19 and chronic diseases and how to stay safe while living with a chronic disease. So we will go straight into the topic for today. I'm going to share my screen and then we can start. All right. Okay, so we're going to be talking about ways to stay safe from COVID-19 while living with a chronic disease. It's important to understand that, at least for one of the reasons why we are doing this, is that breast cancer is a chronic disease, and from the CDC, WHO information and all the research that has been done so far, it's been found that breast cancer patients or people living with breast cancer, they are immunocompromised, and that means that they have a high risk of having issues when it comes to getting infected with COVID-19. So it's important that we look at the different ways to stay safe and what to do to ensure that everyone is safe, we are fine. And of course, other cases of COVID-19, some people have other causes of other chronic diseases such as hypertension, diabetes, and all of that. So we're going to look at all of that and see how we can all stay safe. So the outline today, or at the end of this webinar, we're going to understand COVID-19, the signs and symptoms, which we already know, but we'll reiterate them, the current statistics in the United States, connecting chronic diseases and COVID-19, and then we'll look at the practical ways to stay safe, and we'll look at the CDC guidelines for grocery shopping. That is really very important, because we all cannot do without grocery shopping. We all cannot do without going out. So we're going to be looking at some of the guidelines to help us, stay safe. First, we'll look at the introduction of COVID-19. And COVID-19 is an infectious disease that was caused by a recently discovered strain known as coronavirus, and it's called SARS-CoV-2. Coronavirus is a form of virus that causes different forms of diseases, but specifically COVID-19 is the name that is given to the strain of virus that we are experiencing right now. Initially, before now, nothing was known about the virus until in December 2019 in Wuhan, China, when it broke out initially. And in January 31st, it was announced by WHO as a public health emergency of international concern. And the entire world began to look at this virus and began to become aware of this virus. And in March 11, it became a pandemic because it has spread to other parts of the country, other countries across the world. It has become a global issue because it is now, found in different parts of the world or in different countries of the world. So nothing is known of the exact source of this virus so far. And then the good news about it is that 80% of people who are infected with this disease recover from it without even needing hospital treatment at all. And around 1 out of every 5 person who contract COVID-19 becomes seriously ill and develops difficulty in breathing. 1 out of every 5 person who contracts this disease becomes seriously ill and develops difficulty in breathing. Older people and those with underlying medical problems like high blood pressure, diabetes, heart and lung problems, cancer, are at higher risk of developing serious illness. So these are the group of people that we're going to be focusing on today and see how we can actually stay safe, okay? So frontline workers or essential workers are largely exposed to potential COVID-19 infection. So people who work at the airports, who receive passengers, or screen passengers, people who work at the supermarkets, grocery shops. These are frontline workers, people who have interactions with people every single day, or a large number of people every day, are frontline workers. So if you belong to this category of people, there is that risk of exposure to COVID-19 infection. And there's currently no scientific evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection. So for people who think that if you had been infected by COVID-19 before, that you may not be infected by it again, there has not been any scientific evidence to prove that. So it means that if you have recovered from COVID-19 infection before now, it's important that you also still keep safe. You also still follow the public health rules that would help you to stay safe, because there is no evidence to show that you have been immune to it and you will not be reinfected if you get exposed again. So that is really very important. Now, just to reiterate all of the signs and symptoms of COVID-19, I know that we've been hearing about this, we've seen it everywhere, all of the materials around, all of the things that we do, we've been seeing all of this information, but it's important that we reiterate this. Fever or chills is one of the signs and symptoms. In fact, the primary fundamental sign and symptom of COVID-19 is fever. In fact, for every infectious disease, fever cuts across every infectious disease. So fever is very important, is one sign that we must look out for. Cough is another sign. Tiredness is another sign. Shortness of breath or difficulty in breathing is another sign. Muscles or body aches, is another sign. Headache, new loss of taste or smell. When you can't taste your food that you eat, you can't smell anything. If someone says that this place is stinking and your nose cannot really smell that stench or that smell, it means that it's a sign that you have to look out for. Sore throat is another sign. Congestion or runny nose is one other sign. Nausea or runny nose is another sign. Diarrhea is one other sign. Okay, so these are some of the signs and symptoms of COVID-19. All right, now it's been, from research, it takes usually between 1 to 14 days, averagely 5 or 6 days, for people exposed to COVID-19 to start showing the signs and symptoms. Okay, and that's why usually they tell people to quarantine or self-isolate for 14 days, because that's the period between which the signs and symptoms would manifest. So if after 14 days you don't feel any signs and symptoms, then you're free to move around, you're free to go around. So that's really very important. Some COVID-19 infected persons, however, show no symptoms and are said to be asymptomatic. Okay, so asymptomatic people, or people who are said to be asymptomatic, are people who don't show any signs and symptoms of COVID-19. But the interesting thing about it is that they don't show signs and symptoms. They don't know that they are sick. They don't know that they have the virus. At the same time, that possibility of spreading the virus is there, because they have the virus within them and they are not showing signs. And that's actually very dangerous. So it's important that we have, this in mind as we discuss. All right. Now, for modes of transmission, people can contract COVID-19 from others who have the virus. Okay, so the virus does not just drop from anywhere. It has to be from someone who has contracted the virus. And this virus spreads from one person to another through droplets, from their nose, from their mouth. Okay, when these droplets are expelled and we inhale them, then we can get infected by it. So when these droplets are expelled, and they can be expelled through cough, through sneezing, through talking, and then if we now inhale these droplets from an infected person, and we inhale it into our lungs, then the virus will stick to our lungs and begin to multiply and begin to cause the signs and symptoms that we've discussed earlier. Since these droplets are really heavy, okay, they don't last so much on the air because they are heavy. They don't travel through very long distance. And that's why also COVID-19 is not airborne. So after just a short period of time, it falls to the ground or on surfaces, okay? So transmission is more likely when people are very close to you. So that's why it's important that you practice social distancing, because people who tend to be infected by the virus get it because they are really very close to people and they're exposed to those people for a very long time. Okay, so that's really very critical. So we need to understand that. Now, there's something I just said. The portals of entry are the mouth, the nose, and the eyes. Okay, so if you want to remember this, remember MEN, men. Okay, so avoid men, avoid touching men. Let's use that word. Avoid touching men, which means avoid touching your mouth, avoid touching your nose, avoid touching your eyes. Okay, avoid people talking to your nose, into your nose, your mouth, or your eyes if you're not putting on a face mask as well. So that's why it's important you stand 6 feet away from people. All right. So other modes of transmission, the spread can occur when persons touch objects and surfaces. Okay, when we touch doorknobs, when we touch handrails, when we, touch tables or surfaces that has been infected by the virus or contaminated by the virus or by the droplets, and we now use those hands and touch our eyes and our nose and our mouth, then we can get ourselves infected. All right. Community spread is easy and sustained when increasing number of persons have been infected with the virus in a given area, including some persons who are not sure how or where they became infected. All right. So it's easy to spread this virus, because if it begins to spread in communities, people actually spread it because they don't even know where they get it from. They don't know that they are sick. And those of them who actually know that they are sick and refuse to isolate themselves can actually spread this. And once it gets into a community, it starts from one family and then it moves to another family. Before you know it, the entire community is infected by this virus. And then the natural reservoir of COVID-19 is still unknown. We don't know where it came from. Some people are speculating that it came from bats. Some people are saying from other animals, but we don't know. But then the possible animal source of COVID-19 has not yet been confirmed, as the research is actually ongoing. Right now, there's no drug, there's no vaccine for COVID-19, but then there are other Western and traditional or home remedies that people are using to alleviate the symptoms. So it's more like a palliative care. People are just using some traditional, some Western, or some home remedies to just alleviate the symptoms, but then it's important to note that WHO CDC does not recommend any form of self-medication with any antibiotics or anti-malaria. Hydroxychloroquine is not a recommendation. Okay, so right now there are clinical trials that are going on, both for Western medicine and also even for traditional medicine. And the idea is that at a time or very soon there will be the production or the production of vaccines, or there will be the production of medications that will help for the treatment or prevention of this disease. But as at this moment, nothing has happened yet. Clinical trials are still going on. Now, as of today in the United States, we have 7 million cases, 894,768. Okay, 7 million cases, over 7 million cases already in the United States, and the total number of deaths are 216,025. Okay, 831 plus new death cases have occurred as well. And this is telling you that it is a serious issue and we must continue to take it seriously. Now, living with a chronic disease is something that we have, or some of us have found ourselves, to come into. All right. So at a point in our lives, we're diagnosed of being infected, or being of diagnosed of having maybe cancer, breast cancer, or diabetes, or hypertension, or something. So it is something that we just found ourselves to have. All right. So because of that, it's important that we learn to manage not just the disease, but as well as how to stay safe. All right, of how to stay safe. So chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention, or limit activities of daily living, or both. Okay, so chronic diseases such as heart diseases, cancer, and diabetes are the leading causes of death and disability in the United States. Adults of any age with certain underlying medical conditions are at increased risk of severe illness from the virus that causes COVID-19. Okay, we have said that earlier on, that people who have underlying medical conditions are at risk for severe illness. Okay, and because of this, it's important that we remain careful and we try as much as we can to stay safe. That is very, very important. And then there are examples of chronic diseases, that are actually connected, or by research so far are connected to COVID-19. Adults of any age with the following conditions are at increased risk of severe illness from the virus that causes COVID-19. Cancer is one of them. Chronic kidney disease is another. Chronic obstructive pulmonary disease is one of them. Heart conditions such as heart failure, coronary artery disease, or cardiomyopathies are one of them. Immunocompromised state, weakened immune system from solid organ transplant. If you've done a solid organ transplant, of course, usually at points like this, the immune system is weakened. So you are an immunocompromised person. It's important that you understand that you possibly you possibly have an increased risk of severe illness. Okay, and then sickle cell disease, type 2 diabetes, the chronic diseases that we have to look at. All right. Now, there are some that might be at an increased risk. Okay. So the first set of chronic diseases I mentioned, they are at increased risk. By research, it has been proven that this set of people that have such chronic diseases are at increased risk. But then there are also some who might be at an increased risk. Okay, so this means that research is still going on, but right now these ones might be at increased risk. If you have asthma, if you have cerebrovascular diseases, if you have cystic fibrosis, liver disease, type 1 diabetes mellitus, you might be at an increased risk. Okay, that's something that you need to note. All right, so if you have a chronic disease, you are at an increased risk, or you might be at an increased risk. What are the things that you have to do? What are the actions that you have to take to ensure that you stay safe? All right. Now, one of it is that you must have a conversation with your healthcare provider or care team to discuss your individual level of risk based on your condition, your treatment, and the level of transmission in your community. This is really very important. Talk to your healthcare provider, get to find out what level of risk that you have. Let them have that conversation with them, see how the treatment plan is going, see what level of transmission is going on in your community. For instance, if you have, 2 or 3 million people in your state or in your community that are infected, it means that you may have a high risk of getting infected if you get exposed to people. So this is really very important. Do not stop taking your medication, okay, or alter your treatment plan without talking to your healthcare provider. Have that in mind. Make sure you have 30-day supply of your medicines. Don't stop taking your medications. Have 30-day supply, because it's actually advisable that you stay indoors most of the time. So this is really very critical. Do not delay life-saving treatment or emergency care. Do not delay life-saving treatment or emergency care. Call your healthcare provider or care team if you have concerns about your condition, your treatment. If you think that you may have been exposed to someone that has COVID-19, have that conversations with them. If you have pressing questions, have those conversations with them. If you feel stressed, have conversations with them. If you don't have a healthcare provider, contact your nearest community health center or your health department. So that's really very, very important that we note. All right. So let's look at how to stay safe. Okay, we've talked about some of the things that we need to do as individuals who have COVID-19, who have chronic diseases. Now, it's important that we get to see how we stay safe. These are things that we know already. Know the signs and symptoms of COVID-19. Look out for signs and symptoms, among contacts. For instance, your co-workers, your household, community members, people you interact with. It's important that if you know the signs and symptoms, it will be easy to actually look out for these signs and symptoms in people, so that you understand how to protect yourself. Avoid overcrowding, overcrowded spaces. If you find out that there are places that are overcrowded, please don't go there. If you want to use the train and you find out that it's overcrowded, please just hold on or look for a place that is not overcrowded. Maintain at least 6 feet distance between yourself and some other people or other people. Avoid touching your mouth, your ears, and your eyes and your nose. Avoid men. Avoid touching men. Mouth, eyes, and nose. Practice good respiratory hygiene. That's really very important. We're going to be talking about that later, and we'll see what practicing good respiratory hygiene means. Okay? Wash your hands thoroughly with soap and water for at least 20 seconds. That is really very important. In fact, hand washing is the most effective way to prevent infection, because our hands are the means of interaction, with everything. So it's important that we try as much as we can to wash our hands every time. Use appropriate personal protective equipment as much as possible. Most importantly, your face mask, your nose and face mask, your mouth, mask is very, very important. If you have fever, cough, and difficulty in breathing, please call the COVID-19 hotline, call 911, call the healthcare institution that you have to call. And if you don't have any healthcare provider, please contact your nearest community health center or health department. Very, very critical. All right, so we're going to be looking at some infection prevention measures. There are different infection prevention measures that we're going to just quickly look at. Respiratory hygiene and cough etiquette is one of it. Hand hygiene is another. Personal protective equipment is another, and cleaning and disinfection is another. So we'll just look at a couple of things or a couple of ways that we can actually prevent infection and stay safe. All right. So respiratory hygiene, if you look at the picture by the side, you'll see that this guy was sneezing, and you can see the distance through which the droplets traveled to the woman's face. And this shows that this woman, if this guy is COVID-19 infected, if this woman, as long as this woman has inhaled this droplet, then this woman is infected as well. All right. So respiratory hygiene etiquette is very important. How do we cough? How do we sneeze? That is really very important to help us decrease the transmission of respiratory illnesses such as COVID-19. Respiratory infection is spread when a person who is infected with a virus coughs, sneezes, or talks. All right. So observing respiratory etiquette prevents the transmission of this virus or any transmissible infection. All right. So one thing is important: when you are coughing, when you are sneezing, the first thing is to cough into your elbows. Okay. You use your hands and cover your nose and your mouth and cough into your elbows. Your elbow is one of those places where you don't use all the time. So if you don't have a face mask on, cough into your elbows. If you have a disposable tissue, cough into the tissue, cover your mouth properly, cough into the tissue, and dispose that tissue. And then you can wash your hands. You have to perform hand hygiene. Stay 6 feet away from people. If you have your face mask, you can cough or sneeze into your face mask. That's fine. You don't have to remove your face mask to cough. Put it on and cough into it. That is really very important. Okay, so let me quickly demonstrate something here. This is a face mask. This is a regular face mask that we use. Okay, let me see if I can stop sharing this screen, and then we can talk looking at me. All right. So this is a face mask. Okay, so this face mask has a metal object here. I'm going to explain what it is used for. All right, so if you have this face mask and you put it on this way, all right, so I have don't worry, I have my headphone is covering it, but then I think you can hear me, so I want you to hear me properly. So you put on your face mask. That is one thing you have to do. Now you look at this place. There's a bridge. There's a metal here that you can actually use to bridge your nose, and then also press it to bridge this place. Now what this does is that it sits on this place and covers all of this place. Okay, and then also make sure that the sides are covered as well, and these sides are covered. Okay, so and then what next other thing you do is to make sure that your mouth is covered, so you can also pull it or pull the face mask to under your chin. All right, so this way you've put on your face mask. Try as much as you can not to touch this place, because this is the contaminated place. So don't touch this place. This face mask prevents you from all of the droplets that comes out of your mouth when you cough, sneeze, or talk to infect someone else. Okay, and it also protects you from getting infected when someone sneezes or coughs or talks. So this is really very important. Now, a lot of us do not know how to wear face masks. A lot of us put it on in different ways that does not help. Okay, so one of the things is that some of us do like this. So we are covering our mouth, but we're not covering our nose. Because we're not covering our nose, we are also still breathing from here. We can inhale droplets, and then at the same time, we can also exhale or sneeze and then send out droplets into the environment. So this is not a good way to put on your face mask. A lot of us also do this. We put it under our chin. All right. Now, when you do this, before now, all of this place has been exposed, to the environment. And then you take the face mask and put it under your chin. All right. If there's COVID-19 under your chin or around this place, this face mask, the inside of the face mask that, you had, the inside of the face mask has been exposed to it. And then you take it and put it back and cover your nose. What have you done? You've infected yourself. All right. If there's COVID-19 already exposed on this place, you've used the inner part to take it and then you put it back on your nose and you've inhaled it. So this is not a good way to put on your face mask. This is not a good way to put on your face mask. Some of us also do something else. We do like this. Okay, the surface is still touching this place, it's touching this place. All right. So this is not a good way to put on our face mask. Okay, so this is really very important. And if you're done using your face mask, it's important that you remove it and then you discard. All right. Now, before you remove your face mask, if you have gone out and you want to discard your face mask, the first thing you should do is to wash your hands first. All right, because you don't want to touch your face. Because you don't want to touch your face, it's important that you wash your hands first before you actually remove your face mask. All right, that is very important. I thought that I should share that with us. Okay, so we would continue with sharing the screen. Okay, so the next thing I would like to talk about would be hand hygiene. Washing your hands, very important. Okay, hand hygiene is actually the most effective way of getting soil or dirt or microorganisms out of your hands. All right, so it's important that you wash your hands or you use antibacterial liquid. You use antibacterial liquid soap to wash your hands and water. All right, or you also use alcohol-based swab when there is no water available. All right, proper hand washing is the single most effective way to prevent or reduce spread of infection. We need to understand that. And then wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, sneezing. Make sure that you wash your hands. Very, very important, for at least 20 seconds. I'm going to show you guys the technique of how to wash your hands. It is important to know that before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing or sneezing, after handling your mask, after changing a diaper, after caring for someone sick, after touching animals or pets, please wash your hands. Okay, if soap and water are not really readily available, use a hand sanitizer. Let it be, when you check it, make sure that it is at least 60% alcohol based. Okay, cover all surfaces with your hands and rub them together until they feel dry. That is really very important. I'm going to show you guys how to use this. Avoid touching your eyes, your nose, your mouth. Avoid touching men. All right, with unwashed hands. If your hands are not washed, please do not touch your eyes, your nose, and your mouth. Okay, now this is how to wash your hands. If you look at this diagram, you see you have to first wet your hands with water, apply a soap, and rub your palms very well. After you are done rubbing your palms, then you interlace your hands, okay, your fingers. You interlace them, this way, and then the other way, palm to palm with fingers interlaced, first at the dorsum, left dorsum with interlaced fingers and vice versa. You do this, and then you do this palm to palm interlaced, and then back of the fingers to opposing palms with fingers interlocked. Now, these are the back of your fingers. You want to wash this place. So you do this to wash. And then the step C is your thumb. Rotationally, you do this to wash your thumb. And then the next thing is your fingers. You want to make them clean. So you do this to make them clean. Rotational, way. You do that. And then when you are done, you also do your wrist. Okay, the wrist part is not here, but it's important. You also do that of your wrist. You rinse, then you use a paper towel to dry up your hands. Use that same paper towel to close the faucet, and then your hands are clean. If you need it, you also need a paper towel to open the door knob. Okay, so that is really very important. What I'm going to do is I'm going to show you guys how to also use the hand sanitizer. It is the same process, okay, for washing your hands and using a hand sanitizer to clean your hands. All right. So let me stop sharing the screen right now, and then I can All right. So first of all, remove your rings. If you want to wash your hands or you want to use a hand sanitizer, remove your rings, remove your watch. So if it's for water, first wash your hands with water and then you take the soap. Okay, so let's assume this is soap and water, or this is the hand sanitizer. It's still the same process. All right, so first thing first is to rub, make sure that it wets everywhere, and then interlace. The idea of this, those interlace them, fingers locked. While you're doing this is in between your fingers, you're trying to get that place clean. And then palm to palm, interlace as well. You do this, and then you want to clean this part of your fingers. So you do this, and then both parts are clean. And the next thing is your thumb. You do this, and the next thing is your fingers. You want to do it in a rotational manner so your fingers are clean. You do this. The next thing is your wrist. You do this and you rinse with water if you are washing your hands. But then if you are using your hand sanitizer, because you can see my hands are dry already and I'm done. Now, when you rinse your hands, you take a paper towel to wipe your hands. Use that same paper towel to close the faucet and also to open the door, and then you discard the paper towel. All right. So that's the process for cleaning your hands. That's the WHO technique. A lot of us do not actually know this technique. We just wash our hands and we don't wash it effectively. So it is very important that we understand this. All right. Now for personal protective equipment, we're just going to be talking about the face mask. In fact, I've actually talked about it. Okay. So if you want to use your face mask, first of all, when you're done and you want to remove it, you lean forward and then you remove it. All right. You lean forward and you remove it. You're leaning forward because you don't want it to touch your body or touch any other part of your body. You lean forward and you remove it. There are different types of face masks. This is another type of face mask. They are all effective. When you're done, first of all, like I said, before you remove your face mask, wash your hands, all right, because you're trying to touch your face. Okay, so when you're done removing your face mask, also wash your hands. That is really very critical. All right. Now, these are different ways or different types of face mask. I've already demonstrated that earlier. All right. So, cleaning and disinfection. Clean and disinfect surfaces. Clean and disinfect every place that people actually touch. Switches, doorknobs, countertops, handles, desk, phones, keyboards, toilets, faucets, sinks. Clean and disinfect. Okay. Now, if surfaces are dirty, clean them. Use soap and water to clean them. Disinfection means that you are killing the virus or you're killing any bacteria on a surface. And that's why you use things like Jik. So Jik helps you to disinfect. All right. Jik helps you to disinfect. So clean is use soap and water to clean surfaces. Disinfection is also using Jik or antibacterial wipes to actually clean those surfaces, especially if you have somebody who is COVID-19 or who is COVID-19 infected and they are in your environment or they are around you. Try as much as you can to disinfect surfaces that they've touched. Okay. The cars, you open your cars, people open and close and enter it. Make sure that you disinfect it. It is very, very important. Now, it's also important to monitor your health, monitor your health every day, especially for those of, for people who have chronic diseases. It's important to monitor your health. Watch out for fever, especially if you think that you have been exposed to someone, or you went out and someone was talking for a long time and you didn't have your face mask or something. Try as much as you can to monitor your health. Watch for fever, watch for cough, shortness of breath, or other symptoms of COVID-19. Now, it is really very important, just try as much as you can to do that. If you think you were not 6 feet, with, if you were not within 6 feet with somebody and the person was talking, try as much as you can to watch your health. Okay, look out for fever, look out for cough, look out for shortness of breath. Take your temperature if symptoms develop. All right, you may begin to feel feverish. That does not mean that it's COVID-19, but if you begin to feel feverish, also try as much as you can to take your temperature. Now, do not take temperature within 30 minutes of exercising. That won't work, okay, because your temperature level may rise. Okay, do not take temperature when you are taking a medication that lowers temperature. For instance, you're taking a paracetamol, ibuprofen, it crashes the fever level. So try as much as you can, not to, like acetaminophen. These are things that you try as much as you can to not, check your temperature if you've taken this within 30 minutes, because you won't get the right reading. Okay, so this is really very, very, very important. Okay, now, the last thing that I'm going to conclude on are the CDC guidelines for grocery shopping. We can't do without grocery shopping. One of the things I would advise is that if you're going for grocery shopping as someone who has chronic disease, ensure that you at least do it once in a month. Okay, once in a month. That's really very important. If you have somebody who can go and do grocery shopping for you, that would be great. Okay, online shopping is very useful. Okay, if you can get somebody to do online shopping for you, that's perfect. All right, so it will avoid you going to the grocery shop. All right, so avoid shopping if you're sick or have symptoms of COVID-19. That's the standard. Avoid shopping. If possible, limit visiting the grocery stores or other stores selling household essentials in person. In general, the more closely you interact with other people and the longer the interaction, there's a higher risk for you. Okay, so it's important that you understand that. So other groceries and other online, or other groceries and other items online for home delivery or curbside pickup. All right, or check with your local grocery store to see if pre-order or drive up options are available. All right, so it's important. If you can order online. You don't have to have interactions with these people. They drop it for you. If you can pick it up, you pick it up, and then you keep moving. All right, wear face mask in public settings when around people who don't live in your household, especially when social distancing is difficult. All right, if you go to a grocery shop, some people may be close to you. Put on your face mask. There is a standard. In fact, the good thing about it is that every grocery shop has it as a standard. So you don't go into the grocery shop without putting on a face mask. When you do have a visit, when you do have to visit in person, go during hours when fewer people will be there. All right. Okay. So go during hours when fewer people will be there. For instance, like in the afternoon, a lot of people will be at work. Those are good times to go grocery shopping, or early in the morning when the shop just opens. That's a good time to go grocery shopping. But then in the evenings, you have a lot of people who visit the grocery shop. So go at times when you have fewer people. All right. If you're at a higher risk for severe illness, find out if the store has special hours for people at higher risk. Okay. If they have times for people who have chronic disease or who are at higher risk, find out and then go to shop at those times. Okay, so if you normally bring your own usable shopping bag, ensure they are clean before you use them. All right, some locations they've temporarily banned the use of reusable shopping bags during COVID-19 pandemic. So check your state, local store or market policies before bringing reusable bags. All right, that's also very critical, because somebody who has COVID-19 or who is infected with COVID-19 can actually take their bags, or which is already infected, take it to the store, and the attendant would touch it and also have to touch other people's bags. So it's important that you find out if the stores allow it. If they don't allow it, that's awesome. But if they allow it, make sure yours is clean. Disinfect the shopping cart. Use disinfecting wipes if available. Have a disinfecting wipe. Okay, if you have a disinfecting wipe, the rails of the cart, clean that place where you have to touch and push the cart. That is really important. That will help you stay safe. Do not touch your eyes, your nose, or your mouth. That's a standard. Please do not do that. All right, now currently the risk of infection um, from COVID-19, from food products, food packaging, or bags is thought to be low. All right. So they are very low. But however, it is always important to follow good food safety practices. All right. The packages, yeah, the viruses can stay on some of these packages for hours or for days, but then it's still low in terms of getting people infected. So, but then we have to just keep to the rules. When unpacking your groceries, Refrigerate or freeze meat, poultry, eggs, seafood, and other perishables within 2 hours of purchasing them. All right, try as much as you can to put them in the freezer or refrigerate them as quickly as possible. Do not use disinfectants designed for hard surfaces such as bleach or ammonia on food package or cardboard or plastic wraps. All right. Okay, so bleach, ammonia are used for hard surfaces. They are not used for food items. So don't use those to disinfect your food packages or disinfect your food. Now, after unpacking your groceries, wash your hands with soap and water for at least 20 seconds. If soap and water are not available, use your hand sanitizer that contains at least 60% alcohol. Now, when you get home, there's water. So wash your hands. All right. Wash your hands. And then you can remove your face mask as well. Regularly clean, and when you're done removing your face mask, wash your hands again. All right. Regularly clean and disinfect kitchen counters using a commercially available disinfectant product. All right. Regularly clean and disinfect kitchen counters. This is really important because you have to, when you get back, you will put all of the food items on the kitchen counter. Make sure that you disinfect um, regularly. All right. So that is what I have for you today. And let me just give you one more tip. All right. Let me give you one more tip. Now, it's important that, for instance, public places, we've said that let's avoid public places. If you must, if you must go to a public place, ensure that you use your face mask. All right. Now, I know that at this period, Thanksgiving is coming up, um, Christmas is coming up, and a lot of people or families will begin to travel to meet, okay, spend time together during Thanksgiving, spend time during Christmas. So there's a possible risk for exposure. So it's important that when families are traveling, have that rule that if anyone thinks that they have been exposed to someone who may have had COVID-19, or they're not even sure, but they've been exposed to somebody by coughing, the person coughed or sneezed or something, let them isolate themselves for 14 days before they travel, all right, to make sure that they are not COVID-19 infected, all right. So that is really very important. If you're not sure, if you think you have been exposed, try as much as you can to stay away from that trip. Isolate for 14 days and be sure that you are okay and be sure that you're well. If you are sick, don't travel. That is a standard. That is a given. All right. So that way we can actually prevent the spread of COVID-19 um, during this period where we would have, people traveling from one place to the other and families interacting all the time. All right. So thank you guys for watching today's webinar. Thank you guys for um, the interactions. Please share this video, um, share it to as many people as possible so that other people can actually learn and improve themselves and also stay safe. All right. Thank you very much, guys. We have another webinar, or we have some other webinar coming up. On the 23rd of October, we'll have another webinar coming up. So we're going to be talking about it. We'll share about it, and we expect that you register and be a part of it. All right. So thank you very much, everyone, for joining. And bye.